So I'm here with a lovely young lady, and she has pigmentation on her face. The cheeks got better, but the forehead did not. What she has is she has melasma, and what I want you to hear is some of the important questions that she asks. And she's had this for about 3 months. We've been taking care of her for about 3 months. How long
Yes.
have I something like that. I mean, in April, I told you to use the cream twice a day on the
Mhm.
cheeks.
Mm-hmm.
Did you get any redness or irritation?
No.
Okay.
No.
So the cream that I use is a cream that has three components. It has a retinoid, has a topical steroid, and has a bleaching cream. And it's not too strong bleaching cream. The reason for those three components is because together they bring down the pigmentation, but do not cause redness, which could then leave more pigmentation. Because whenever your skin is inflamed, it becomes like a magnet to the sun and it can leave pigment. But not only the sun, it can also lead to pigmentation if you're exposed to what we're all exposed to, the phone. And the phone has blue light, also has some heat. Both of those things can lead to pigmentation. Even the fluorescent light bulbs at home or when you're cooking, all those things, these exposures can lead to pigmentation. So there are a couple of things that you can do. One of them is when you have the sunblock, you want to look at the ingredients. And this is a mineral sunblock and it has very good ingredients. There are different companies. It really doesn't matter which company, but when you are buying it, you want to make sure that it has physical sunblock. So you look here, you see titanium oxide and zinc oxide, which are the most effective physical blocker because you put it on, unless you wash it off, it doesn't expire. Other that are chemical work in a different mechanism where they will be deactivated in 2 to 4 hours from the moment you apply it, even before you went outside. It's kind of like time starts ticking. And the other thing, which is iron oxide. Iron oxide is the only product that can block visible light. Yes, so from 400 nanometers, whatever, it's 395, it blocks the visible light, which can also lead to the pigmentation. And this is something that we discovered maybe in the last 4 years, 5 years. We didn't realize before that visible light can also lead to increased pigmentation in people who are susceptible to the melasma. The other thing that you could do is you can do the tranexamic acid, which is what you're doing, those pills that you're taking. So if it's safe, if you don't have any contraindication, you can take those pills. And also they can be used in the cream, which is what you're using. And they're different, it has inside in the cream as well. But again, the penetration is more effective when it's from the inside to the outside. Now, after using those things, if it still does not improve it, right? So we're lightening it and we're preventing new pigmentation from forming by using the sun protection. Then what we can do is we can take the tranexamic acid safely and through microneedling, put it in the upper layer of the skin. And that will help lighten it even further. So I've had people who are really, really dark. I mean, you were much better. You're looking at it like, I don't really see much. I mean, you see, because you remember how you were before. But anybody from the outside doesn't really appreciate the pigmentation much. And they were much worse. And when I did this with the microneedling with the tranexamic acid, it cleared. So there are other options that we can do. Again, the problem is not necessarily clearing it. The problem is to keep it from not returning. And that's what we're trying to teach your pigment producing cell called melanocytes to come down and not be so like on steroids, start right away
So what do I
producing more
do
pigment.
like in the summer? Because I work in the city
Right.
and I go to work 3 o'clock in the day. So you know this when summer is coming up, you know the sun's gonna be very hot. So what do I do from there? Is it that I put the sunscreen on when I'm going out or I'm in the house? Should I wear it inside the house?
Brilliant question. So the answer is, as we said, because visible light, which is the fluorescent light, the regular light, the blue light from the computer especially, can also lead to pigmentation. The answer is yes. Now, makeup does have some sun protection in it, but it's usually a chemical. It's not a physical sunblock. So mineral sunblock, like one of those, like we have here, this ISDM company, but again, any company, you can apply on the skin that will protect it. The one thing that, to be honest, in my theoretical theory is that when you apply minerals or you apply any kind of crystals, not in a cream form, they can go in the air. So either you have good air circulation around, or you take a deep breath, apply it, and then you breathe out. So you don't like inhale the particles until they're like on your skin, because like silica and other stuff and you know in powders they found can cause issues when you inhale them later on years down the line. I mean we'll inhale a lot of garbage. So the issue is all of them add up later on in life, and we don't want to have other issues.
Right. So how do I apply?
Well,
Do
and
I
another
put
thing,
this one first, and then that one?
right? So
So when I wash my face.
perfect question.
Okay.
Perfect question.
Before I forget now, what do I use to wash my face?
Okay. So let me get first back to what you do when you go at 3 o'clock in the afternoon. So first of all, yes, you are using the sunblock. The sunblock is like your coat. It's the final thing that you apply after everything.
Right. I know that.
When you wash your face, you want to make sure you don't irritate it, because any irritation, as I said, will lead to redness. Redness can lead to pigmentation. It makes your skin more susceptible. It breaks your defense mechanism. So you want to keep the healthy bacteria on. You want to keep the healthy oil on, not to over dry it. So preferably to wash with plain water, no soap. Okay. Preferably with cooler water. It will keep you younger than with warmer water.
Right. I try to not to use the hot water to wash my face.
Good.
I try to use the coldest water.
That's perfect. That's what I do in the morning
Yeah,
too.
I try to use the coldest.
Excellent.
Yeah.
The next thing after you do the water, you keep it a little bit damp, and then you apply the next thing. The next thing is the strongest medication that we want to use. So if we're trying to lighten it, we're going to use the bleaching cream first.
Okay.
After that, we do the next cream, which would be the one with the tranexamic acid and the vitamin A cream. Then you put that on next. That is if your skin can tolerate that. So far it was able to tolerate, so that's fine. If it can't, then what we do before we apply it, to temper it, to reduce the strength of it, we apply a moisturizer. And the moisturizer, the more bland it is, the better, because all moisturizers now, they want to sell you anti-aging against
that's what I want
wrinkles.
to find from you. What moisturizer can I use?
The simplest, the best. CeraVe, Eucerin, Aquaphor even. So a simple thing like Aquaphor will do great, but again, you have to put it on wet skin with wet hands, and then a little bit of it will go a long way. So if you take a little bit, so let me just show you how much. This
Like
is
a little
for the
piece of
whole
pizza.
face. And you can say, how can this little thing go the whole face? Why? Because you take it with water, and when you take it with water, and if you have water
On a damp face.
all over your face, right, and it's still damp, you put it like this on the hand.
So you don't need a whole lot of face.
No. And then it's fine. There's extra. You can leave it on your hands, air dried, and then you go ahead and you put the rest of the creams on. Yes, and that will right. So it's all. There's a lot of stuff. I'm just showing you just a few. Next time we can explain more in detail.
Cosrx moisturizer I use. So I'm wondering if that's a good one for me to use. I wish I bring it here today.
Next time you can bring it, we'll look at the ingredients. It's really not the name, it's the ingredients. So
Right,
the
okay.
simpler, the better, because less chemicals will interact with the other stuff that you apply on, so they can work better. Because sometimes some chemicals cannot be together.
Right.
You know, they cancel one another. So after you put water, you apply the bleaching cream, which is first. Then you apply the medication, and then the last one you put the sun. It's a sunblock.
Right.
The sunscreen and sunblock are different. Sunscreen is a chemical. Sunblock is a physical. It's kind of like you have the other thing, which you see a lot of the Asians. They walk with umbrellas, and it kind of looks cute and funny. Well, the reason is this is direct sunlight, so the heat and the sun is reduced when they do that. And it may look funny, but it is actually very helpful if you really care about your skin. And why they do that? Because for thousands of years, they realized in order to protect their fair skin, they have to wear that. In Malaysia, you see people riding on motorcycles, and they're always with these helmets and shades all the time. And even if when they don't, they try to keep their face constantly covered because the sun is very, very strong, and they want to keep their skin melasma free,
Yeah.
pigment free. I'm not saying go to work with
I
a motorcycle
know,
helmet,
I know,
but
I know.
use the sunblock and the umbrella if you can. Nice. They have some nice umbrella. It looks very cute. You can do that too. And the other question you had was about the washing the face. We said that the moisturizer afterwards. And do I miss anything, Dana? Is there anything else you want to know?
I get to know how to use that in order.
Right. So that's
I
the
wash
last.
my face, and then I put the cream on it, and
The
then
bleaching.
I do the
And
sunblock.
then you put this, and then the last is the
Right,
sunblock.
this, right.
So it's like you have
one,
right now. So it's
two,
like you have the underwear and bra. Is
Mhm.
like you're putting the water, right? And then you the moisturizer if you need to. Then you have the shirt that you put on top, and then finally
So
is
if
the
I have
raincoat,
so
which
if I
is the
have the
sunblock.
moisturizer, I put the moisturizer before the sunblock.
You put the moisturizer before the sunblock.
Right.
Correct.
Okay.
Correct.
Okay.
And if you forget
That
something,
makes
you give us a call.
I will.
All right.
I will. Just like when I got the pills, and I went to the pharmacy, and when I do the read up on Google, it's saying that it's for heavy bleeding,
All right.
and I call immediately because it's kind of scary.
Right.
But you explain, and I take a chance and I took it, and I'm okay.
Of course.
I didn't because I'm not having any heavy bleeding. So, but no, it was okay. I didn't have any side effects or anything.
Good. And you're having better results, which is really the key.
Yeah. It's just like I just want to get rid of these things. I'm very conscious of it, and I just want to get rid of it.
Well, we'll help you as much as we can.
Yeah. All right.
Together we will win.
Absolutely.
Good job.
Okay.
Pleasure.
Josh,
And thank you for allowing them to learn from you. Thank you.
Yes.
Thank you. If you liked the episode and found it useful, please let us know by liking us and leaving a comment. Thank you.